Alright, today we're diving into Broca's aphasia, a neurological condition that affects language production and is essential for understanding how brain function impacts communication. Let's get started. Broca's aphasia is a specific type of aphasia, which refers to the loss or impairment of language abilities. When someone has aphasia, they may struggle with speaking, reading, writing, or even understanding language. In Broca's aphasia, the issue lies with expressive language. People know what they want to say, but they have trouble getting the words out. This condition occurs due to damage in Broca's area, a part of the brain responsible for both language comprehension and production. It's located in the dominant hemisphere, which for most people, especially right-handed individuals, is the left hemisphere. One of the most common causes of Broca's aphasia is a stroke, specifically one that affects the superior division of the left middle cerebral artery. However, it can also be caused by traumatic brain injury, brain tumors, or cerebral hemorrhage. So, how do you know if someone has Broca's aphasia? Their speech tends to be slow and effortful. They might speak in short, broken sentences with limited grammar, but they usually manage to convey basic meaning. It's like hearing someone say, yes, Tuesday, Dad and Kevin, Dad, mail, Tuesday. The words are fragmented, but you get the gist of what they're trying to say. Despite these speech difficulties, comprehension remains mostly intact. People with Broca's aphasia can usually understand what others are saying, or they may have only mild impairment. They're also very aware of their own speech issues, which can lead to frustration. To diagnose Broca's aphasia, doctors often use imaging techniques like a CT scan or MRI. A CT scan can show signs of bleeding or stroke, while an MRI provides a more detailed look at the brain, especially when diffusion tensor imaging is used to check for changes in white matter. Functional imaging techniques like SPECT or PET scans might also be employed to observe regional brain activity and pinpoint areas that aren't functioning correctly. In terms of treatment, addressing the underlying cause, whether it's a stroke, tumor, or something else, is the first step. Many individuals show improvement within the first month, but speech therapy is crucial and should start as soon as possible. The earlier therapy begins, the better the chances of regaining language skills. So, to recap, Broca's aphasia makes it difficult to express language, but comprehension is largely preserved. It's most often caused by a stroke, and while speech may be slow and fragmented, communication is still possible. Early intervention, especially with speech therapy, is key to helping individuals regain their abilities. And before you go, if you're looking for more resources to help you study, be sure to check out King of the Curve. You can also download our app for access to more educational content like this. Whether you're prepping for an exam or just curious about neuroscience, King of the Curve has got you covered. See you next time.